Okay, good morning, students. So yesterday we have discussed the 20 questions now. So I have even sent the PDF also. So all of you have written down that the PDF that I have sent.
Yes, ma'am.
Okay, those
Yes,
20.
ma'am.
Okay, so today we will be discussing again another question, okay, which after discussion, I will be sending this PDF again. So you write down all this every day, like you write a little bit. I don't want to give you all in one day, so many questions. Little we will discuss, and at the end, just before the final, like you can get the maximum questions. So, okay. Okay, can you see the screen?
Yes, ma'am.
Okay. Okay, now is it clear?
Yes, ma'am.
Uh, Okay, so number one question, that is yesterday we discussed till 20 now. So today we will discuss from 21. That is GFR will increase. So GFR means glomerular filtration rate, okay? Glomerular filtration rate will increase if, so see the option, if the circulating blood volume increases, if the afferent arterial resistance increases. So like no need to read the other option, you just know that the GFR will increase, okay, if the plasma protein concentration decreases, if the plasma protein concentration decrease होने से GFR increase होगा, that you need to know, okay? So if you see this option, you can choose as option D. So if this option is written in option A also, you'll choose option A. So you just need to know is that GFR increase with the decrease in concentration of plasma protein. So are you clear? Are you clear?
Yes, ma'am.
Okay, okay.
Yes, ma'am.
Okay. So number 22. So let's move on to number 22. The patient with kidney disease must manage fluid intake because why? See the question nicely, okay? The patient with kidney disease, that means patient will have kidney disease, okay? The patient with kidney disease must manage fluid intake. Why? Because what? Because fluid retention can cause swelling and weight gain. Is it correct? Patient with kidney disease must manage fluid intake. Understand? Every time I used to tell you all now that fluid and electrolyte balance, all those. So everything need to be balanced. The amount of intake, the amount of the electrolyte, everything should be balanced. Every time I used to say now. So that is the question. So the patient with kidney disease must manage fluid intake because the fluid retention can cause swelling and weight gain. So is it true? Number A is? Is it
Yes,
true?
ma'am.
Yes. Yes, because we have to manage the fluid intake, isn't it? Otherwise, if we won't manage the amount of intake, fluid that we intake, okay, then that will lead to swelling and weight gain. Understand? Sarir full jata hai, all those, this edema and all. So sarir full jata. So option number A is correct. Then it will also like affect our blood pressure. That means the patient with kidney disease must manage fluid intake, because if when we have kidney disease and when we don't manage the fluid intake, what can happen? That can affect our blood pressure also, because in maximum of the kidney disease, you got high BP, high blood pressure, isn't it? Yes or no?
Yes, ma'am.
Okay,
Yes,
so
ma'am.
this can affect our blood pressure. That means option B is also correct. So again, option C is what? Overload can cause in heart trouble. So you got that even yesterday itself also, like in cardiology, now in heart, there can also be trouble in heart. I gave you yesterday, not yesterday, day before yesterday, I think we have discussed in end stage renal disease, that is kidney diseases. Not it, even the clinical features I have discussed there in the cardiac, there can also occur a cardiologic problem. So This is very important. So this is also correct. So the option number D is all of the above. So that means option A is correct, B is also correct, C is also correct. That is why option number D is the correct answer. That is all of the above. Are you clear? Yes or no?
Yes, ma'am.
Okay, okay.
Yes, ma'am.
Okay, if you have any doubts, you can ask me anytime. Okay, okay, let's move on to number 23. So what is number 23? So number 23 is common non-specific symptoms of chronic kidney disease include, so increased urination at night, loss of appetite, swelling of hand and feet. So common non-specific, it's not, they're not saying that it's very like specific, okay, common but non-specific symptoms of chronic kidney disease. So what were the like symptoms that we find in chronic kidney disease? Okay, will there be increased urination at night? I think I already explained this. Will there be increased urination at night with chronic kidney disease? Yes or no?
Yes, ma'am. Yes, ma'am.
Okay. Will there be loss of appetite? Will there be loss of appetite?
Yes, ma'am.
Okay.
Yes, ma'am.
Will there be swelling of hands and feet? Swelling of hands and feet?
Yes.
Yes, ma'am.
Okay. Swelling
Ma'am.
of hands and feet is also known as edema. Okay. So, and then the option number D is all of the above. That means option A, B, C, D, everything is correct. That is why we have choose option D as the answer. So 21, 22, 23, it's already clear. So let's move on to 24. So the most common question which I keep on asking again and again. So acute renal failure is generally identified by oliguria. Okay, so urine output less than dash ml per day. So what will be, how this is the, like, you have to fill this, it's like fill in the blank. So you have to fill this. So what will be the answer? See the question, acute renal failure is generally identified by oliguria. Understand? Even in the definition also you got, isn't it? Acute renal failure. I gave the definition. So one of you, can you please read out the definition of acute renal failure? Ilasara, can you please take a favor and please read the definition of acute renal failure?
Acute renal failure is the sudden decline in renal failure, usually marked by decreased GFR, glomerular filtration rate, and increase in concentration of BUN, that is blood urea nitrogen.
Okay.
Creatinine, the urine output is less than 400 ml per day.
Okay, you can
Oliguria,
stop. You can
hyperkalemia,
stop.
and sodium retention.
Okay, you can stop there. What did you get? The urine output is less than? Urine output is less than? What do you have?
400 ml per
400
So,
ml per
so
day.
if the urine output is less than 400 ml, so in the definition you got is not it. So that will indicate that if a person have urine output less than 400 ml, then you can identify that he have a kidney disease. And the name of that kidney disease is acute renal failure. So are you clear? Why the option A is the answer? Are you clear?
Yes, ma'am.
Yes,
Yes, ma'am.
Okay, okay, let's move on. So next, so this one you need to like by heart. Okay, so peculiarity of renal colic is that, see, I have given option A. This one you by heart. Okay, peculiarity of renal colic is that it radiates from the loin to the groin. This is the like peculiarity of renal colic. Okay, so it radiates from the loin to the groin. This, don't think that this is spelling is wrong. It is like this. So this number 25. So the answer is option A. These are some of the like previous question. So you can choose is option A. You need to by heart this. You need to know all this peculiarity of renal colic. Okay, it radiates from the loin to the groin. So if you know this, no need to like read the other options, because all these are not the peculiarity of renal colic. Okay, it radiates from the umbilicus to lower abdomen. It is peaks in the pain epigastrium. All this no need, because you already know na peculiarity of renal colic is it will radiate from loin to groin. You just need to do loin se groin tak radiate karta hai, not to umbilicus to lower abdomen. All this, if you know this, so if this question come, you can directly choose this. So are you clear? Question number 21, 22, 23, 24, 25. Shall we move on?
Yes.
Okay, let's move on to
Yes.
the
Yes, ma'am.
Yes, ma'am.
okay. So number 26. So this is very, very interesting. Each of the following features are characteristic of the nephrotic syndrome, okay, except, see, except, so one of the best method is you just turn out the definition that I give you for nephrotic syndrome. So each of the following features are characteristic of the nephrotic syndrome. So whatever option, that is option A, B, C, D is given now. So here in the question, it is mentioned that each of the features are the characteristic feature of nephrotic syndrome. Lekin, except bola, except which one? Which one is not the characteristic of nephrotic syndrome? Here, it is not mentioned that about the clinical manifestation, okay? Characteristic is different. So characteristic you will find from the definition. So in the definition you check, is there marked proteinuria? Is there hypoalbuminemia? Is there edema? Is there hypertension? So what will be the answer? So Srijana, can you please read out the definition of nephrotic syndrome? Definition of nephrotic syndrome?
The term nephrotic syndrome is coined from two words, nephros, in Greek meaning kidney, and syndrome denoting a group of symptoms. Nephrotic syndrome is a primary glomerular disease. It is characterized by high level of protein or albumin in the urine,
Yes, high
low
level of
level of protein
wait,
in the
stop,
blood,
stop, stop. Wait, stop, wait. High level of, what did you say? High level of protein or?
protein, albumin.
Okay. And then? Keep on reading.
Low level of protein in blood, hypoalbuminemia.
Okay.
Increased level of lipid in the blood, hyperlipidemia, and
Okay.
edema, usually swelling of body parts.
Okay, swelling of body parts is edema, isn't it? Okay, so
Yes, ma'am.
now can you, now all of you, can you tell me, so which one will be the answer? According to the question, कौन सा वाला answer होगा?
Hypertension.
Okay, all of you are clear why hypertension is the answer? Are you clear? Yes or no?
Yes, ma'am.
Yes, because
Yes.
marked proteinuria is the characteristic feature of nephrotic syndrome. Hypoalbuminemia bhi hota hai, albumin present hota hai. So and then edema bhi hota hai, like swelling over the body or any parts of the like body. And then like in hypertension is not the characteristic feature. Okay, it can be the clinical manifestation, the sign and symptom, but this is not the characteristic that denotes that a person suffer from nephrotic syndrome. So that is why option D is the correct answer. So let's move on 27. So what is 27? Urinalysis result include proteinuria, many RBC and red blood casts, and 1 to 2 white blood cell per high power field. Which of the following disease best fit with this finding? So this is the answer is number D, that is acute post-streptococcal glomerulonephritis. So I think this was not my part. It's not it that glomerulonephritis, isn't it? Yes or no?
Yes, ma'am.
Yes, but if this type of question comes now, because all this glomerulonephritis, it might be like the part of this kidney stone and all now. So you need to know this answer. So this is the urinalysis result include, okay, when a person have urinalysis ka matlab urine test hai. Urine test, in the urine test result it include proteinuria, okay. यूरिन टेस्ट जब किया तो उसका रिजल्ट क्या होगा? द रिजल्ट विल इंक्लूड प्रोटीन्यूरिया एंड मैनी आरबीसी एंड रेड ब्लड क्लास एज वेल एज 1 to 2 white blood cell per high power. Okay, ये सब दिखाई देगा. तो which of the following disease best fit with this finding? So So in simple way, if you want to understand this question, okay, suppose a urine is collected, okay, your urine is collected, and you have done that that urine that you have collected, you have done for urine culture, that is urine test. So when you perform the urine test, so the result or the investigation or the finding that you get is proteinuria. Proteinuria or protein are present in your urine, and many RBCs and many red blood casts and 1 to 2 white blood cells are present. Okay, per high power field. All these results, if you find after doing urine test, then that finding can directly detect that a person suffer from acute post streptococcal glomerulonephritis. So are you clear? Are you clear? Or else I need to explain again.
Yes.
All of you, I could not hear your voice. All of you are clear this, or you want one more
Yes,
time?
ma'am.
Clear, right?
Yes,
Okay, okay. Don't be like silent, okay? Okay. Number 28. So in adult polycystic kidney disease, each of the following statement is true, except, see the question nicely, okay? So in adults polycystic kidney disease, that is PKD, okay? Each of the following statement is true, except, so the disease, number option A is the disease is familiar. Familiar, I think this is familiar. It will be familiar. And then the other one is the renal involvement is occasionally unilateral. And then the disease generally asymptomatic until early adult or middle life. This one also we have seen. The disease is like familiar, means polycystic kidney disease, number option A, okay? Or the disease is familiar means in polycystic kidney disease, what happened? You get the types also, it's not it. So you got the two types in polycystic. What were the two types? Virginia, what were the two types? Oh God, the day only I give. What were the two types? Types of PKD. Okay, whoever know, please say. What were the types of PKD? या फिर मैंने सिखाया ही नहीं.
ADPKD and AR.
Yes, say.
ADPKD and
AD, PKD and
ARPKD, ma'am.
yes, ADPKD is not it. That autosomal dominant polycystic kidney disease, and then I think autosomal recessive polycystic kidney disease. All those I gave you all now. So that too is both are polycystic kidney disease. Okay, but in both the kidney they have cysts. Whether they have many cysts or whether they have less cysts, that doesn't matter. Okay, but cyst is present. So there is a similarity in the disease. So option number A is correct. So now let's come to option number C. So number C, that is the disease generally asymptomatic until early adult or middle life. I already gave you this one, isn't it? Like in the definition, it appear at this age, all this. Did I give or not? In unilateral at this age, in this ADPKD, and then again ARPKD at this age, many umar bhi diya tha, age bhi diya tha, that at this age it mainly occur. I give or not? Or,
yes, ma'am.
or else I directly give that it occurs from birth. I give, isn't it? Loudly.
Yes, ma'am.
Okay. So the disease generally is asymptomatic, okay, until early adult or middle life, which is correct. So माने उसका जो means mainly asymptomatic होता है until early adult or middle life. Next is what? Next is number D. So you will find hematuria, hypertensions, and palpable abdominal mass are frequent. So I already explained now, in the even in the abdomen there can be a cyst which can be like palpated, and then clinical findings in symptomatic patients, all this. So option number D is also correct, B is this A is also correct, C is also correct, but the option B is wrong. So Why option B is wrong? So let us read out. The renal involvement is occasionally unilateral. So all of you, I already explained this, so please give me the correct answer. So option B is correct. So option B is the answer. So why option B is the answer? Srijana, can you please explain why option B is the answer with the questions? Explain the answer very nicely.
Ma'am, because in polycystic kidney disease there was unilateral renal agenesis.
Unilateral and then
Renal
was
agenesis.
and then was and then what? Bilateral was there.
Ma'am, yes, ma'am.
Yes. So here in option B, it's written that the renal involvement is occasionally unilateral. So it was not only unilateral, is not it? It can unilateral means what? It affects only the one part of the kidney, is not it? Yes or no, all of you?
Yes,
Yes,
ma'am.
ma'am.
Yes, so that is why this option is wrong. So the renal involvement is occasionally unilateral. So if someone asks you this, someone asks you that why did you choose this option B as the correct answer, then you need to respond that because in polycystic kidney disease we have studied that the renal involvement is occasionally both unilateral as well as bilateral. It can affect one kidney or it can also affect both kidney. So are you clear?
Yes, ma'am.
Yes, ma'am.
क्वेश्चन अच्छी तरह पढ़ो देखो इन एडल्ट पॉलिसिस्टिक किडनी डिजीज each of the following statement is true बोला सब statement true है लेकिन कौन सा वाला true नहीं है वो बोला तो इसलिए we choose this. Okay, let's move to 29. So what is 29? An important conditions causing renal colic is number number answer is hyperparathyroidism. So all these were not my part, but still you need to know all this. So an important condition chronic this hyperparathyroidism जब इंसान का hyperparathyroidism होता है ना, I already explained you all the meaning of hyperparathyroidism. So so this is an important condition that can cause renal colic. So what was hyperthyroidism? Don't say I did not give you the meaning of hyperthyroidism. It was in some disease. Hyperthyroidism का मतलब क्या है? Any one of you say na? Always try to be the one who could give the best answer. Hyperthyroidism.
Ma'am, overproduction of hormones.
Yes, overproduction of hormone. Okay. Okay, hormone. Okay, it's correct. We have many hormones, right? So here see hyperparathyroidism bola na, तो उसका मतलब है कि means hyperparathyroidism means like there will be like overactive thyroid. That means हमारा जो thyroid means what, how to say, जो hormone है ना, the thyroxine, that will be the production of that hormone, the thyroxine hormone. Okay, the thyroxine hormone, there will be excess production. So that is why it is known as hyperthyroidism. So this is an important condition that can cause renal colic. So this is the answer. All of you know this. So next is number 30. So the typical features of adult. I think this question is incomplete or what? Okay, let me check once again. Okay, you just like don't write this. Okay, if anyone have written, don't write this number 30 question. So let's move on. Number 31. So renal calculi may be the result of GOT. It occurs as a complication of hyperparathyroidism, and most frequently it contains calcium, oxalate, and phosphorus? And the answer is all of the above. So all these renal calculi, that is, what was the other name of renal calculi? Ilasara? Dibyajit, what is the other name of renal calculi? These all were not my part. This question is not my part, because that's why, like, what is the meaning of renal calculi? Any one of you can answer. Renal calculi.
Membrane.
Yeah, Srijana, say loudly.
Membranal stone.
Yes, renal, renal stone. Okay, it's correct. Renal calculi, you can call renal stone, kidney stone, or you can also call like nephrolithiasis. All these were the other name. Okay, so these were taught by this Saban man, I guess. Isn't it, Srijana?
Yes, ma'am.
Okay. Okay, renal calculi. So the answer is option D. Okay, that is option D. That is all of the above. So renal calculi may be the result of GOT. The renal calculi occur as a complication of hyperthyroidism, which is also true. Renal calculi most frequently contain calcium oxalate, and phosphorus. So the answer is all of the above. So that is about the renal calculi. So let's move on to number 30. So this is also like similar with the previous questions. Okay, you already know this answer. So the nephrotic syndrome is characterized by all of the following except. So just the option are changed. So tell me the answer.
Hematuria.
Okay, hematuria, because in this nephrotic patient you will find edema, proteinuria, hyperproteinemia, all this you will find, but you won't find hematuria in the characteristic feature that is in the definition. So option B is the correct answer. Okay, Srijana, please take attendance. Okay. So now the next question, the most interesting question which you have known from this first semester is the structure that connect a kidney to the urinary bladder is the which one? Option is given. So which one? The answer given is ureter. So tell me, is it correct?
Ureter.
The option is ureter. So it is correct. See the question. The structure, the name of the structure, okay? The structure that will connect a kidney to the urinary bladder. What was the name of the structure? What was the name of the structure?
Ureter.
Yes. So what is ureter? What is ureter? So if the definition come, what is ureter? So you have to write that ureter is the structure that connect a kidney to the urinary bladder. Okay, or you can simply call that ureter. The ureter means it is a tube, okay, that used to carry, it is a tube that used to carry our urine from the kidney to the urinary bladder. Understand? Understand how many ureter we have?
Two, ma'am.
Two. Understand? One is attached to the right kidney, the other one is attached to the left kidney. So okay, okay, you are clear. Okay, so let's move on. Next is mild proteinuria is termed when protein excretion in urine per day is less than 3.5 gram per day. Okay, remember this means like when a person have the urine, okay, urine output that is less than 3.5 gram per day. Okay, that means you when you excrete your urine, okay, then you will find the amount of protein present in your urine is less than 3.5 gram per day. Then you will consider that you have mild proteinuria. Understand? But if the amount of protein that you excrete in your urine is more than 3.5 gram per day, then you cannot consider that you have mild proteinuria. Or if the urine means the amount of protein that you excrete in your urine, if it is less than 5 gram per day, then you cannot consider that you have mild proteinuria. And if the amount of protein you excrete in urine is more than 1 gram per day, then that can also not be considered as mild proteinuria. That is why option A is the answer. So these are all the numerical value that you just need to know, like all those anuria, kitna ml excrete hone se, like usko anuria bulata hai, and then means like if you excrete less than 400 ml, so what is that term, oliguria, all this. So if you excrete the amount of protein that you excrete in your urine is less than 3.5 gram per day, then you can consider that a person have mild proteinuria. So don't forget, okay? This 3.5 gram. Will you forget? Don't forget, okay?
No.
Okay, okay. Don't forget all this. Next, सबसे easy. If a person is put in dialysis, he is suffering from heart disease, kidney disease, respiratory disease, या none of the above. मुझे तो लगता है the answer is none of the above. Is it correct? Am I correct? Surajit, where is Surajit? Surajit, are you present? Surajit, are you present? Can you hear me or sleeping? I think Surajit is sleeping. He can't hear me, I think. Okay, Ishan, can you hear me? Ishan, can you hear me? Ishan also sleeping, I think. Ishan, can you hear me or sleeping?
Yes, ma'am.
Okay, all of you, like, when I used to explain, yes, when I used to explain, I never used to stop. So when I ask something, means don't let me wait. Always use that. When you let me wait, it shows that you are not concentrating. You are in alag dunia. You are in somewhere else. So Surajit, what if a person is put in dialysis? Okay, no problem. Maybe network. Okay. If a person is put in dialysis, he is suffering from what type of disease? Say fast.
One kidney failed to work.
When kidney failed to work. Okay. Okay, that means kidney disease. So the answer of question number 35 is kidney disease. Okay, are you clear, all of you?
Kidney disease.
Yes, ma'am.
Okay, okay. Okay, let's move on. Okay. Next is 36. So medically speaking, which term refer to kidney function? Okay. So in medically, हम kidney बोलने से, like, what is the other name of kidney? We call as hepatic, we call as renal, we call as dialysis, we call as urinal. So kidney बोलने से, like, उसको दूसरा नाम क्या है medically? See? Renal. Okay, renal, that's correct. Okay, kidney की जगह में renal भी लिख सकते हैं. So the answer is renal. So next, acute renal failure is generally identified by oliguria, where urine output. Here again, I repeated the question. So what will be the option? Acute renal failure is generally identified by oliguria. So when the urine output is less than
400
Okay, good. Okay, next. If the urine output increases more than 2 liters per day, then it is termed as, say fast.
polyuria.
Yeah, polyuria. क्योंकि ये सब, like, the option is already given, and even in your notes also have already given that if a person means urine output is 2 liters per day, or else if it is more than 2 liters per day, then it indicates that it is polyuria. Okay. Okay, so next is Okay, we can't continue because the time is very less, only 2 minutes. Okay, significant bacteriuria contain organism in the midstream examination of urine. That is, the answer is more than 100,000. Okay, if it is more than 100,000, then it indicate that significant bacteriuria are contain organism in the midstream examination of urine. So all these are not my part, but still, like, I want you all to know. So now option A is the correct answer. So the next is number 40. Medical therapy for removal of renal stone less than 5 mm size is? The option is to sip 2 to 3 liter of water daily. So here it is mentioned that medical therapy for removal of renal stone less than, अगर किसी का renal stone ही हाँ, लेकिन उसका जो renal stone ही 5 mm size है, that is 5 millimeter, that means छोटा है 5 millimeter size. If it is less than 5 millimeter size, okay, then the best way for the medical therapy, the best way of medical therapy to remove this renal stone is rose din, like sip 2 to 3 liter of water daily you have to take. Sip karke 2 to 3 liter of water daily you have to take. So this is the medical therapy, okay? So that is option A. So are you clear? This 20 question we discussed today. Are you clear?
Yes.
Yes, ma'am.
Okay, I will be sending you all the PDF. Okay, you write down again. It's only like 1 minute left. Okay, Srijana, are you done with attendance?
Yes, ma'am.
Okay. That's all for today. Okay, thank you, everyone.
Thank you, ma'am.
Ma'am.